When someone needs a higher level of care, ThedaCare Orthopedic Care offers surgeries ranging from minimally invasive to complex procedures. Here to tell us more is Dr. Nickolas Linkous, an Orthopedic Sports Surgeon. Thanks for being with us, Dr. Linkous.
Absolutely.
So tell us what you do as an Orthopedic Sports Surgeon.
So as an Orthopedic Sports Surgeon, I've done extra fellowship training, specializing in both minimally invasive and open procedures to repair torn ligaments or reconstruct torn ligaments, or sometimes address shoulder replacements if needed.
So you really do see patients from all levels of care and age?
Yes, yep, we get a wide range.
And we're talking baseball, softball, things like that today. What are some of the surgeries that you often perform in baseball and softball players?
It's most common in our throwing athletes. We're seeing shoulder and elbow injuries. So from the shoulder standpoint, a slap tear, which is a labral tear, that's very common. And at the elbow, usually in our pitchers, someone throwing at a higher velocity, we're talking about the UCL injury or ligament tear, the surgery that everyone knows is the Tommy John surgery.
And that's what I was going to ask. Is that pretty common more? I know that, there are so many things in place right now to protect young pitchers and their throwing arms and pitch counts and injury prevention. Do you see a lot of those Tommy John surgeries now?
Less so than before, but it is still common. Usually these can be treated without surgery, so the surgery itself is not as common. But when we do see it, it's usually in a pitcher.
Okay, and that does make sense. You also perform hip and knee surgeries. Can you tell us a little bit about those?
So from the hip and knee standpoint, especially with our throwing athletes, not as common as the upper extremities. I do hip arthroscopy, labral repairs. So sometimes in our throwing athletes, because they use so much of that hip and kind of torso to generate the torque, you will see labral tears. So we sometimes have to do minimally invasive surgery to repair the hip labrum. And then from the knee standpoint, a lot of times we see that in sliding. And less common than our football and soccer players, but ACL injuries, meniscus tears do tend to plague all athletes, including softball and baseball players.
Okay, that's good information for us. And like we talked about, you're a sports surgeon, but that doesn't mean that you're only, working with athletes. Can you talk about why it's so important for you to be available for people who might not be athletes?
Our goal as a sports surgeon is preservation and getting someone back to whatever that activity or level of function was before their injury. For athletes, that's usually defined by return to sport. But for people like you or I who are not professional athletes, that's usually just getting back to sleeping comfortably, or waking up without pain, or taking care of your kids, or getting up to the top shelf.
That's so important too, because it means that you're living your best life, or whatever that is for you.
People really underestimate a shoulder, hip, or knee injury until they have one that's dictating their day-to-day routine.
Okay, Dr. Linkous, this has been great information. Thanks for being with us.
Of course.